Thank you very much for the call. Let us now go to Chaya, who's calling from Brooklyn. Chaya.
Yes, hi. Thank you for taking my call. I'd like to know I suffer on reflux, and I am on Acifix every day. I would like to get off it, and as soon as I get off it, I get heartburn again. And in the other hand, to take it every day, I know it's not the right thing either. What's the right thing to do in such a time?
Well, Chaya, what did your doctor tell you?
My doctor tells me to take it, and the nutrition says not to take it because it kills the acid in the stomach.
Right. Well, it doesn't kill it. It stops acid production.
And there is a certain acid that every person has to have, right?
Right. Well, Chaya, this is the dilemma of life. Who do you listen to? And the bottom line is you have to feel what's right for you.
Does Acifix, by taking Acifix every day, does that have side effects?
Walking across the street can have a side effect. Yes, every medication has side effects, but there's something called the risk-benefit ratio. And you have to decide what's better for you, to have the risk of a small side effect or to be free of your illness. That's why you need a good physician and just somebody to talk to and somebody who knows your body and somebody who you can work these issues out.
Thank you.
Okay, now let us go to Faggy, who's calling from Williamsburg. Faggy?
Yes, first I would like to know two things. Does thyroid have to do with weight loss?
Excuse me?
Thyroid disease.
Thyroid. Please lower your radio in the background, ma'am.
Yes, if you're hyperthyroid, one of the effects is to lose weight, and if you're hypothyroid, which means your thyroid is underactive, people do gain weight. Yes, Faggy.
And also, when you at the end of night or Friday night when you go to sleep on a full stomach, I know you shouldn't, but what happens when you do?
Well, if you shouldn't, if you wouldn't, then you'd never find out.
No, but when you're tired,
Take a walk around the block.
That's a good one.
Twice.
Okay, no problem.
Thank you. I'm not a doctor, but that's what I would tell you. I hope the doctor doesn't mind that I...
No. This is your radio show. I go along with you.
Does that disturb from weight loss?
Excuse me?
Does that disturb from weight loss?
Well, if you go to sleep with a belly full of food, you're not exactly losing weight.
That's why you have to eat before the mitzvah. Let us now go to Nechama, who's calling from Borough Park. Nechama?
Hi, doctor.
Hi.
Soaking beans. I know beans are very beneficial. It's, we all use them Shabbos. I remember seeing an old Rebbetzin soaking them, and then I remember hearing, reading that you should soak them. It removes certain saccharides. And I've been doing it, and I taught my daughters to do it. We freeze a batch of them, and then we freeze them, keep in the freezer in little bags.
Yeah. So anyway,
I think it's very good. But
good.
I want to hear your input on that.
It's very good. It will remove some of the sugars that may cause some of the bloating. Yes, it's very good.
It works very well, and you don't have to do it.
Yes, I'll recommend that to people if they have issues with eating a lot of beans. Yes, soaking them may help.
Thank you for the question. Let us now go to Bertha, who's calling from Borough Park. Bertha?
I would like to ask you whether I have chills in my body, whether this could come from thyroid, because I went to the doctor and they thought it's thyroid. They took a test.
Bertha.
Okay.
Bertha, you have chills in your body?
Yeah. Not always.
That's very nonspecific, and in Borough Park they have very good doctors. I know they have some wonderful physicians, and ask them and let them run some tests to figure out what's going on.
They took a test, and they said the thyroid is all right.
Well, let them do some more things, and let them see if you need some supplementation, and let them.
So could you advise? Because I have been to many good doctors. And
well, this is really on gastrointestinal diseases, so I'm going to stick my specialty to that.
I also have reflux.
Yeah.
You think that would be because of that too?
Probably not.
Bertha, I think what the doctor's trying to say is that it's very difficult to diagnose and treat people on the radio. So he would advocate that you see your own physician.
Thank you for the call. Let us now go to Gittel, who's calling from Borough Park. Gittel?
Doctor?
Yes.
Doctor, how often do I have to take his colonoscopies?
Oh, that's a very good question, Gittel. What happens is it's recommended over the age of 50, African Americans of 45, to have one screening colonoscopy. And if nothing is found, some people say you can go 5 years, some people say you can go 10 years. Medicare has some requirements. But if you have a polyp, then we follow every 3 years. If there's something else found, we have to do it more frequently. And it's a very, very good question. I'm glad you asked. A lot of people are asking about all the heartburn and overeating, but I think that colonoscopy is for everybody. Both men and women should have their colonoscopies. Do not be afraid of it. Go to somebody who does a lot of them. Speak to your gastroenterologist about it. This is something that me and my colleagues do every single day in large numbers. Today you can have anesthesia and not feel it, and you can be cleared and not worry about colon cancer. And we've been having some very, very shocking cases where very young people have found to have symptoms that they're ignoring. So please make sure that your internist, discuss with your internist, and go for your colonoscopy or your colon screening on a regular basis to make sure that you did not suffer from that disease. Thank you. That question was excellent, Gaethel. Thank you.
Thank you, doctor, very much.
Thank you very much for the call. Our number in the studio is 212-529-4620, 212-529-4620. Alan?
Dr. Gettenberg, let me just ask you something. You had mentioned something about a colonoscopy and having the ability for anesthesia. Where you work at the Brooklyn Endoscopy and Ambulatory Surgery Center, do you have anesthesia? Do you have an anesthesiologist who's able to administer this for this test?
Wow, that's a great question. The answer is yes. And not only do we have an anesthesia team, we have a team that works together to do this in an efficient, a very quick way and very easy way, a way that people will not be scared to have their colonoscopy. I know that a lot of men especially do not have it done unless their wives push them. And unfortunately, it skips through, and then unfortunately we find a case where somebody said, I knew I should have had it done but didn't have it done. It's easy. And we don't mandate that you have anesthesia, but anesthesia is a very nice way to have it done. You have a short sleep. Anesthesia is very safe. It's not the same anesthesia that you get when you go for surgery. It lasts just a few minutes. You are watched totally. We have cardiac monitor, respiratory monitors, and it makes the procedure a pleasure. And people always wake up and they say, wow, if I knew it would be this quick and this easy, I should have come many years beforehand. So it's a great way to have it done without any pain, without any discomfort, and you can be free of the question, do I have a serious problem there? And if we do find something, we can remove it easily and safely without it ever developing into a malignancy.
Yeah, correct me if I'm wrong. The colonoscopy consists of either a wire or a camera or some fiber optics that are passed through the gut. And you had mentioned earlier that the gut can consist of 25 feet, perhaps. You're dealing with a moving object. The gut moves in and of itself. How do you assure that you don't poke through an intestine that weaves and winds and is just coupled onto itself? How does that actually happen?
Right.
It may sound a little strange, but
right.
From my point of view, I just don't know how that works.
Sure. There are a few things. Number one, the technological advances are just amazing. It's very similar today to playing a video game. What we do is we train for many years, and we do thousands and thousands. I may have done 25,000 colonoscopies or more in my life. And what happens is that we train to respect the body and not to harm the body, and we know when to remove things, when not to remove things, and we are very careful, and we have a full staff, including anesthesiologists and nurses who assist us, and everything done on high definition, high technological equipment in our facility, and all the equipment is the latest, and the training is the latest. We go to constant updates and constant reviews. We learn the latest techniques and go over our techniques. As a matter of fact, we teach this to many younger physicians because we're so good at it. And because we live in a very, very busy area with lots of people, we've done many, many more than a lot of people in other cities have done.